it over to you.
Hi, everyone. I'm glad to be here today. I know Jen is usually our point of contact for intro from the center, but she's on some much needed and well-deserved PTO. So I'm happy to be here. I am the Networking and Partnership Specialist at the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. And just wanted to say welcome and thank you for attending our July Prevention Exchange Forum, where we are meeting to share our successes and shape solutions with one another. And I think if this is your first time attending, I just wanted to give sort of a little overview of what the center is. The Prevention Exchange is one of the center's core activities. So a little bit about our purpose and our mission. The Center of Excellence, there are many centers of excellence across Ohio, but this is for behavioral health prevention and promotion. And we serve to enhance the quality of life for all Ohioans across the state of Ohio. The center does this by working with federal, state, and local partners to institutionalize the core components of the science of behavioral health prevention and promotion. It's also our purpose to diffuse and support the implementation of research-informed frameworks and ultimately to become the central access point for Ohio's prevention professionals and for other folks interested in prevention. This is really important to the center because what we're trying to do is collectively across disciplines, across specialties and backgrounds, really develop and harness the knowledge and skills and attitudes related to prevention science. So the Prevention Exchange, why we're here today, is a wonderful opportunity to work toward that mission. And today's forum is very aptly titled, Prevention is a Process, Not a Program, Collaborating Across Specialties to Reach a Common Goal. And our Tessa, yeah, she is our part of our facilitation team, Tessa Miracle. She's a research scientist with the Pacific Institute of Research and Evaluation, is going to moderate today, and I'm going to hand it over to her to introduce our speakers. Oh, you're on mute.
Sorry, guys, I apologize about that. Trying to share my screen and the slides and find the unmute and work between letting folks in the breakout rooms. I could not get to the unmute, so I apologize about that. Thank you so much for joining us today. My name is Tessa Miracle, and as Sarah shared, I am a member of the facilitation team with the center. And my role today is just to support our lovely panelists as they work through our discussion today. So let me just share my screen really quickly, and then we will give some great intros. So we have Laura Rooney, who is the Assistant Chief of the Office of Public Health Excellence in the Ohio Department of Health. We have Dr. Jill Jackson, who's an education consultant with the Ohio Department of Education. And we also have Sarah Music from the Ohio Department of Education, who's a prevention education coordinator. Today, we are going to identify some strategies to build a holistic prevention strategy across specialties. We're also going to identify opportunities to collaborate across sectors to reach a common goal. Recognizing that we all work in this space, our tools look a little different though. So sometimes that means we approach that same problem a little bit differently. So I would like to invite our panelists to provide some brief introductions before we move into their slides. So Dr. Jackson, can we start with you? No? Okay, let's start with Laura. Laura, I understand the difficulties of the unmute button hiding from you. So let's start with Laura.
Hi, everyone. My name is Laura Rooney, and first of all, let me apologize for not having video. There's a technical glitch that we've been having. We did try to work through that. I have a background in school health education and a master's in public health. I've been working in nonprofit as well as state government throughout my career. I've been with the Ohio Department of Health for almost 14 years, and I have worked with almost all of the state agencies, but a specific focus that I've had throughout my time has been school health and looking at student health as well as student education outcomes. And throughout our partnerships that we've had at the state and the local level, we've looked at systems and how can we coordinate our systems and also look at what is the education system trying to do and how can our outside communities and collaborators support the districts and what they're trying to achieve, as well as our common goals within public health or mental health and addiction or some of our other partners. So I've worked with our other speaker, Dr. Jill Jackson, for many years and are very excited to work together again and talk about how public health can work with all of you in the prevention specialty as we support school systems. So thank you very much.
Thank you. Dr. Jackson.
Thank you for your patience. My mute button was hiding from me. Good afternoon, everyone. I'm glad to be here. So I have been practicing and been a prevention specialist for over 20 years. I provided direct service and managed community-based prevention programs and work with multifaceted entities, Department of Education. Those experiences really yielded me great experience, knowledges, and expertise in coming to the Department of Education and initially managing, and I really wanted to share this with you all, what is known as our Title IV funds. So if you work with school districts, that's just kind of an extra plug that I'm sharing with you, and maybe even a note to take if you're not familiar with Title IV funds, which are federal funds school districts get to provide prevention and intervention programming. More recently, my work has focused more on what is now known in Ohio as comprehensive school safety strategies. And we're going to probably dive into that a little bit more as far as that content and those topics later on in the presentation. But thank you so very much for having us, and we're looking forward to our conversation today.
Absolutely. And Sarah, please unmute and introduce yourself.
Yeah, good afternoon, everybody. My name is Sarah Music. I am the Prevention Education Coordinator in the Office of Whole Child Supports at the Ohio Department of Education. I have a background experience in public health, specifically health education. I have a master's degree in public health as well as a master's degree in public administration. And I am an Ohio certified prevention consultant as well as a certified health education specialist. I have been a prevention educator in higher education settings as well as K-12 settings, and now work at the department to help schools implement legislation specifically as it relates to prevention. I'm glad to be here today.
Thank you all so much for joining us. We really appreciate it. I know you worked hard to prepare some slides, which is a bit new for us here on Prevention Exchange. So we have some visuals that we're going to work through with you. So as you share a bit of your work, we're really excited to dive a bit deeper into your own experience, your own perspective before we move to these breakout rooms. So I believe we have Laura up first.
Great. Thank you, Tessa. So what I'm going to do is kind of give a high level picture of what we do in public health. And some of this may be very, very familiar to you as prevention specialists, as you have been working with your local ADAM boards and local health departments. So I'm starting off with the State Health Improvement Plan, which we refer to as the SHIP. And then all the 111 local health departments have to also have something that is similar to this called a Community Health Improvement Plan. Many of you may have partnered with local health departments to complete their local plans. And these are things that these are requirements for us at the state and the local level to be accredited. And then there is also Ohio Revised Code, which mandates that local health departments align to the state health improvement plan. So I wanted to start off with the state health improvement plan, show you what our framework is, and let you know that we are actually in the process of updating this. Many local health departments align to what shapes health and well-being in Ohio, and how we will, and the outcomes, which are these health outcomes. And also you'll see that mental health and addiction is one of our major issues, and really 1/6 of this big plan. And so we encourage local health departments to reach out to you as prevention specialists to be a partner on these local plans. It takes all of us to work together in the resources that each of us have. And then as I show you this, I'm going to talk about our population-based approach and the difference between population-based approach to more of a client approach or an individual approach. Talk about how we look at understanding our community and questions that we ask communities, and trying to understand where there are disparities so that we can remove those disparities, focus on equity, and then look at our performance measures and how we are questioning whether we are being successful or not. And then Dr. Jackson will move into how we look at our strategic planning approaches, which are very similar across our 3 systems, from education to mental health and addiction and to public health. And so with this is our state health improvement plan. We have a high focus on equity and looking at who are the most vulnerable populations within the state. And then how can we look at what shapes the health and well-being of those individuals? And we focus on social determinants of health. And those are really what are the factors within where we work, where we live, and where we play. And so within our local CHIPS and state health improvement plan, through our assessment process, we looked at this blue column of community conditions, looking at housing and how housing impacts health and well-being, poverty and your income status, student success. So are students coming to school regularly? Who's chronically absent? What are our grades? Are they ready for kindergarten whenever they approach? What is the graduation rate? Those are some of the measures that we look at for K through 12 success. And then adverse childhood experiences. And I'm sure many of you are well versed in those and how trauma impacts health and well-being. Then we look at 3 major buckets of behavior: tobacco, nutrition, and physical activity. Then access to care. Do they have insurance coverage? Do they have access to physical health care, mental health care services, oral health care services? And then those big things really impact our health outcomes. And traditionally, public health has focused on the more what we call downstream issues of what's happening within chronic disease, looking at heart disease, diabetes, asthma measures. And for in your space, it's depression, suicide, youth drug use, those overdose deaths. But also we've been working on all of that together. And then another area that we're really focused on is maternal and infant health. And our ultimate goal is that all Ohioans have the opportunity to achieve their full health potential. And we want Ohio to be a model in this area. So having a conversation like this, where we're bringing our different systems and work together, is so important. Very excited to talk about this. Then at the bottom of that model, it talks about our strategies and how our strategies align to these factors and these health outcomes and focus on the most vulnerable populations. So next slides, please. And within this framework, we look at something called upstream and downstream. And in San Francisco, they put this framework together that we feel is really the best way to explain this, of looking at, and so we just borrow it from them, we look at social inequities that are happening within the populations, and then we dive deeper into those. And then we look at within those social spheres, what are the institutional systems that we have, and what are the inequities that happen within those systems that may impact those individual health outcomes. And then how can we, as local public health, education, and our maternal and our mental health and addiction partners, how can we come together to look at the policies and systems as how those approach how the school systems work, how are things structured within the community around the physical environment, what are the economic and work environment, and then how all those fit together across healthcare, education, and social systems. Then ultimately get to those more downstream issues that look at individual health outcomes and individual behaviors. So we are encouraging local public health to stay more on this left side of this framework. And so when you look back at that SHIP framework, it's really focusing more on that blue column of social determinants of health than we ever have before. So this is, you should be hearing local health departments speak about social determinants of health and health equity, and moving towards that upstream approach. So in getting to that, how do we determine what we need to do? We'll go to the next slide. So we focus on our assessments and really understanding the community. And this approach is something that our national health experts are encouraging us to do for our accreditation process. And they focus on these three circles. What is the community context? What's the lived experience? What are the strengths and assets? What's happening within that built environment that I talked about before? And what is happening historically within the context of that community that may be impacting structural racism? And then what is the health status of the community that we talked about earlier? And then who are those partners that we can bring to the table? What resources will they have? How can we look at a sustainable approach through policy changes? What data is available and how do we improve capacity? And then looking at that health equity and the power of bringing these partnerships together and the power of that engagement. And so we look at what are the root, there's three questions that we're asking within our assessments. What are the root causes of inequity? How do we impact those? How can partners impact those inequities? And then what can we do together to design those solutions? Even though we may have our own assessments, our own plans, it's coming together across these three questions. And then each of those systems has their way to approach these things. So if you go to the next slide, please. And then we look at how our individual programs and services impact the entire population. And so how does that impact our communities, our cities, our counties? And then we look at a results-based accountability approach, and this is new to our local health departments, but we're looking at how are we evaluating what we're doing and using a collective impact model. So if we'll go to the next slide, please. So we are asking ourselves three questions, and these are from a company called Collective Impact, and they use this theory of results-based accountability. So with everything we're doing now, we're saying, how much are we doing? How much did we do? And who are our customers, and what services did we provide for them? How well did we do it? So that's looking at the evaluation of our services that we are providing. And then is anybody better off? So what happened within those services, and what impact were we able to make through those services? So within the education community, it may be what trainings did we provide? Who did those trainings go to? How well did those trainings go? And then was there a policy or systems change, or were we able to see a change in graduation rates, a change in behaviors within the school district, a change in attendance rates as a result of those strategies that we implemented? So we are building scorecards to actually track this and start to work with our partners at the local level and the state level to do this. And so with that, I think that as Dr. Jackson talks, you'll see how we've been integrating these types of strategies and planning processes to help us start to answer these 3 questions. But this is where you'll start to hear more of this type of work coming from our local health departments. And we're excited for you to hear this as the 3 systems start to work together more.
All right. So from Laura's conversation, I kind of want to highlight a couple things. 1, partnerships. 2nd, use of data. 3, processes that then lead to performance measures and outcomes like Laura described. At the Ohio Department of Education, we can't do anything without our partners. Several years ago, the Ohio Department of Education had a federal grant. So an example of our partnerships and how we, again, do everything together in this space. We had a federal grant, the Safe Schools, Healthy Students grant. And with that grant, we had to collaborate to achieve the federal goals. And in our collaboration, we learned early on that to do the work, to support and serve our communities that were funded by the grant, we needed to talk about how we did the work from our different vantage points and how we were all working in the same direction or could be using the improvement process for the Department of Education or strategic planning processes that everyone uses to determine how best to do this work. And so what I'm going to do is I'm going to kind of describe the outcomes of the approaches to strategic planning that we determined and that we came up with. What we have here is a slide that shares the processes that are used by the Ohio Department of Education to determine behavioral health needs, the improvement process or strategic planning process that's used for prevention education, and then in the Department of Mental Health and Addiction Services, and then the Department of Health. And so when we looked at our processes for how we determined a need and who should be working with us to address these need areas, as well as provide, implement, and then evaluate, we aligned our processes. And so initially, we have the Ohio Department of Education Ohio Improvement Process. This process is a planning process typically used by district and building leadership to determine their local plans for education, how they are going to provide it, and what they're going to report to the Ohio Department of Education for their plans and processes and for doing so. So the Ohio Improvement Process has, again, we've identified the stages and steps for each strategic improvement process. And so initially, we're looking at what school-wide needs there are. And again, Laura described a very extensive and evaluation process to determine need. That is a process that is offered by the Department of Health and local health departments. But again, our Adam Board funded agencies would also have processes for determining need. And as you look across the slide here, we will see each of the ways in which strategic planning and needs are identified. For the Ohio Improvement Process, we have an identified critical needs step. We're going to then go, after we identify need, and look about planning. What does the data tell us? And that should be done, of course, with our partners. We really encourage our districts and building leadership to not complete the Ohio Improvement Process in isolation. In other words, don't just use the folks in your building. Don't just use the folks in your district. We really have to be having these conversations with our behavioral health and public health partners. And so having conversations about what data says, not only for the Department of Education or for local districts and buildings, but what data do our partners bring to the table and are part of the conversations to develop a focused plan. Of course, next would then be implementing the plan and monitoring the focused plan, and then evaluating the process ultimately for sustainability. Next, again, is the evaluation process. I'm gonna go back to that slide. Thank you, Tess, and talk a little bit about PBIS. PBIS is required in Ohio, in our schools. And so there is a strategic planning process there as well for identifying school-wide needs as well as needs for identified students. It has a tiered fidelity inventory. Many of us are familiar with an MTSS or multi-tiered system of approach. And so that is the framework that is used for PBIS to look at those 3 levels of need. As a result of looking at data, same way, a plan is created and implementation of strategies are determined at each level of need. Subsequently, evaluation sustainability taking place. Next, we have the comprehensive system of continuous improvement. Another educational strategic planning process that's used when determining use of federal funds. And so it's often aligned with the Ohio improvement process based on what was identified there. How does that roll over? And how is the decision framework determined to determine goals in districts' plans, create action steps, and then have district goals and monitoring for sustaining those behavioral health strategies and practices that were determined based on their needs assessment. Again, you all are most familiar with the strategic prevention framework, not needing to spend a lot of time on the stiff work, but hopefully you've seen the commonalities in which these strategic planning processes look at population level or school-wide, that would be an equivalent needs to then do an assessment, do a data review, identify critical needs, right? To plan, determine goals as we would do with our educational improvement processes, and have a plan in place for implementation, as you can see consistently across the board as next steps. The SPIF, I'm really glad, has the evidence-based prevention approaches listed there, but that should also be the case and is required in education for implementation of EBPs with then subsequent evaluation and sustainability. Laura has talked a bit about the community health improvement plan approaches, but you all can see population level review to determine plan implementation and sustainability. So I really wanted to intentionally walk through those. I really wanted you all to really see the layout so that as you partner, which is key, because prevention is a process. You can go ahead and go to that next slide now, Tessa. Thank you. I know we were probably running hopefully not too far behind on time. Right. Okay. So so as you think about programming, what level of programming you need, be it universal, selective, or tertiary, you're working with and wanting to implement that, right? In Ohio schools, you're on a team, PBIS team, a building level team that's dealing with student behavior, that's going through those processes. You're bringing your content to the table so that we're ensuring the best identification of student populations, behavioral health needs, evidence-based programs, so we can ultimately see that behavior change and safer and healthier schools in Ohio. Thank you. Sarah?
Yeah, thanks, Jill. I just wanted to further expand on the idea that Jill was just sharing about the interconnectedness between PBIS and prevention. So in Ohio schools, all of our buildings are required to implement the positive behavioral interventions and supports, or PBIS, which, as Jill said, is a strategic planning framework. PBIS requires schools to develop teams, really multidisciplinary teams, to create what are going to be these systems to help improve student outcomes. So it really is working together to build that team. It has to be data driven. So schools are required to be collecting data on their PBIS efforts, and then using those evidence-based practices, again, as Jill mentioned, and then looking at student outcomes. So what's the result of the interventions and practices that they're choosing? I just wanted to show this graphic to, again, expand on this idea of PBIS and its connection with prevention. In PBIS, it's a multi-tiered system of support. Tier 1 is for all students, so they're all receiving information about their behavioral expectations and promoting positive behaviors in the school setting to create, that positive school environment. And then for students who are exhibiting perhaps some behavioral issues, that might go up to a level 2, and then that's for some students, and then level 3, that most intensive or individualized support for students. So hopefully you can make this connection to the continuum of care and see how really that tiered level of approach follows really closely with our universal selected and indicated levels of prevention. I did just want to touch on some of the policies and legislative requirements for our schools and how those relate to prevention. So as I mentioned, PBIS and MTSS, or our multi-tiered system of support, those are required in Ohio for schools to use that multi-tiered structure to support positive behavior in school buildings. We also have health education instructional requirements for our schools in Ohio. Those could range from like drugs of abuse, which a couple of years ago we added electronic smoking devices to that. So that's been a topic of interest, I know, for a lot of schools. And then coming up this school year, we have requirements related to House Bill 123, or the Safe Students Act, which says that all schools need to provide evidence-based instruction in suicide prevention, violence prevention, and social inclusion. And then we've also had some additions more recently, where schools are now required to provide health education in child sexual abuse prevention and sexual violence prevention. So that's another example of how we can be using prevention and evidence-based practices in our school buildings. I also just wanted to mention that our teachers and other school staff have in-service training requirements on a variety of topics. So that's another way that we could see how prevention education is relating to some of the policies that our schools are required to implement. And then I also would just add anti-HIB policies, so our anti-harassment, intimidation, and bullying policies being part of that required policy work that, again, creates those safe and supportive school environments. And so really trying to help schools understand what the policies are and how are they going to implement those in a way that is effective. So they're using evidence-based programming. They are choosing programs that are a practical fit for their school, that they're going to actually be able to implement based on, funding, staffing, that they're culturally competent, and we're helping them implement those to fidelity. So we want to continue working with schools to ensure that they're using prevention efforts that are evidence-based. And then I'll just briefly touch on some data collection and evaluation efforts. In Ohio, all of our school buildings are required to report to the Department of Education each year on the types of prevention-focused services that they're offering. And those reports are published on the Department of Education's website. Schools who use student wellness and success funds or disadvantaged people impact aid are required to report on how they're using that funding. And that gives us some insight into what student needs are and how schools are using funding to meet those needs. Schools can also complete a PBIS tiered fidelity inventory. We do offer some awards for schools at different levels who are further along in their implementation of PBIS. So that's another way that schools can measure how they're doing and really have that data to back their efforts. And then most recently, excitingly, we have the Ohio Youth Surveys website, which provides schools and community members with an easy way to access data from the Oh yes, the YRBS and YTS, so the youth risk, I'm sorry, acronyms, the youth risk behavioral survey, and then the youth tobacco survey, as well as our school health profiles. So an easy way for our schools and districts to now see a variety of different data that they can use to meet that needs assessment, as well as evaluate their efforts. And then really just cross-cutting along everything that everyone said, the need for partnerships and collaboration. So Laura, Jill, and I have all talked about at the state level how the Department of Education is working with mental health and addiction services, the Department of Education, and we also work closely with our partners at the Department of Public Safety and the Ohio School Safety Center on all of these prevention efforts to create, safe and supportive schools. So just thinking about how our schools can partner with educational service centers, state support teams, their ADAMIS boards, prevention specialists, behavioral health providers, local health departments, and then other coalitions and nonprofit agencies that are doing this work as well. So just that continued need to best serve our students and continue to develop these partnerships.
Wonderful. Thank you so much, Sarah, Laura, and Jill. I really appreciate your robust presentation here today. We have some breakout rooms, and I'm so sorry to usher us along quickly. There was so much good information. I didn't want to miss any of it, and we want to give you a chance to talk with our experts. So we have in room 1, we have Laura, who's going to talk, answer questions about the whole child framework. And in room 2, we have Jill and Sarah. We want to know, how can we be resources for the school, and how can we collaborate effectively? I'm going to open these rooms and set a timer. You are welcome to select your own room. We're not assigning you, we're not forcing you into a breakout room. So at the bottom of your screen, there should be, 3 dots that show up, and you might have a notification there. Depending on your version of Zoom, it might be at the top of your screen. What we'd like you to do is self-select into whichever room you'd like to be in. I've got a timer set for 8 minutes. We'll come back together. We'll do a brief report out, and we will reconnect. But just want to thank our presenters one more time. Thank you so much. And just really appreciate your time and energy. So we are going to stop the recording right now because, we want those rooms to be private. So feel free to join the appropriate breakout room now. If you are having trouble joining a breakout room, please. All right, let's start our recording back up. Would love to hear from you guys. Like what went well? What was our aha moment? We've got about 5 minutes for sharing. So would love to hear from you. What was maybe something you learned, something that connected for you? Would just love to hear more.
I just found a whole new set of data tools that I can look into and use. Thank you, Sarah. And I've been doing this for a minute, and I just didn't look on those in that area to try to find data I can use.
Yes.
I wish I would have been clued in a little, about a decade ago. I would have been using a lot of this stuff. Thank you.
I'm glad you have it now. I love it.
Me
Where
too.
are you looking on the ODH site, or where are you looking?
And my thing is, I always rely on the schools for data. So depending on what they want to give up is where I'm stuck with, really. So, and if they want to participate in the data that we collect, the YBRS or the PRIDE surveys and those data tools that we use. So we're kind of handcuffed a little bit, but now, thank you. I appreciate that.
Wonderful, thank you. What else did folks learn about or make a connection on?
Yeah, I would say I wish we had more time, but our group did focus on some data pieces. And as Jose mentioned, the Department of Education has an annual reports website where they list all types of data that's collected from schools. And one of those being the Prevention Services Data Report, which is what we focused on in our group. And Elizabeth was able to share how the Ohio Children's Appalachian Coalition has used some of that data to work with schools and providing them some resources and areas where they could further enhance their prevention efforts. And Elizabeth, I don't know if you want to share any more about that.
Yeah, no, so it's the Appalachian Children Coalition, and I just shared that Sarah was very kind in sharing the data with us so that we could actually drill down and look at all the different schools in the 32 Appalachian counties to see what everybody was doing, and it enabled us to identify schools that didn't have a real robust program. So like I said, we found about 100, I think it was like 100, close to 150 schools that some of what they had was, you know, their prevention efforts existed of a school counselor and maybe doing an assembly a year on vaping or something. And so what that's allowed us to do is focus on those schools kind of first and connecting them with offers for assistance and resources to provide more prevention education for their students. So the data is, I mean, the data really is invaluable to us. So.
Absolutely. And I think that's one of the beauties of the collaboration we're talking about today is, you know, in our work, we often collect similar indicators or indicators that can support one another. So as we collaborate, it's not only on implementation, it's on the assessment piece that we can start look at those systems, you know, like Sarah shared, they're already monitoring their success as they work in schools. They're already monitoring what's being implemented. They're already looking at that. So gosh, why don't we work together to find the gaps we can fill in prevention? Wonderful. I think we have time for one more aha moment.
This is Elizabeth again. This isn't really an aha moment, but I guess I just want to thank, you know, the Ohio Department of Education and OMOS who so willingly share the data with people so that we can evaluate it in our own way. And that, you know, you're not just seeing like a glossy report on things. And I think too often, you know, we feel like we're on our own. And the truth is, you know, we're all working towards the same goal. And it's great to be able to rely on the resources that everybody has to do this. So.
Absolutely. Wonderful. Well, thank you everyone so much for being candid and for sharing the lessons learned. As always, we just run out of time so quickly. So thank you for sharing your time and your energy with us. I wish we could spend another hour. I'm going to hand this back to my friend Sarah to wrap us up and urge folks to do the evaluation.
Thanks, Tessa. I was having a mute moment myself. I think that last comment was wonderful. You know, it was really about collaborating across specialties and systems to reach a common goal. So I'm glad we kind of hit that mark today. So thank you all for joining. And speaking of collaborating and staying connected, would love for you to sign up for our newsletter. You can scan the QR code here or go to the website listed, preventioncoe.ohio.gov. And we have a newsletter that's going to come out in the next couple of days. So I hope you receive that. It's an opt-in only format, so we don't add anyone. You have to go, and this is really out of respect for your privacy. We have really great open rates with our newsletter because everybody that receives it actually signed up for it and wants it. So hope you will do that. You can also find our handles for social media. Although our Twitter logo may change. But please follow us. That's where we put all of our current information, and we would love to connect with you that way. And finally, we have a survey that we would like you to complete. It's really short. Just really, this is a quality measure for us as we're growing and expanding, and we want to make this useful for the prevention workforce in the ways that you tell us you need. So please fill this out for us. And let's see, next month, our prevention exchange, you've already signed up for this one, so you should have the rest of the meeting dates on your calendars. We're coming together again Thursday, August 31st from 1 to 2 p.m. And we're going to be talking about alcohol policy. And we're lining up an amazing panel with some unique perspectives. So I think it's going to be a wonderful session. So hope you can make it. Again, thank you to Tessa for moderating. Thank you to our panel. And most importantly, thank you for joining and participating in this session. We really appreciate it and hope to see you next time.